from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
The president of CHI Health St. Francis and Grand Island says there have been times when they have been close to full.
We've been able to deal with it thus far, but we've got to flatten this curve again.
They are all calling on the public to help, to avoid crowded places, close contact in confined spaces, and to wear a mask.
This is a scary time. It is a serious disease. People need to do the right thing.
And that's why so many health officials across the state are sounding the alarm.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, COVID-19, a letter to Nebraskans. Joining us via Zoom to talk more about it is one of the authors, Christopher Miller. Dr. Miller is a pulmonary and critical care fellow at UNMC. First of all, welcome, Dr. Miller.
Kathy, thank you very much for having me.
You bet. This letter has gotten a lot of attention. For those people who have not seen it, briefly tell us what's in it.
So our letter is just a brief plea to the public to really do what they can to help cut down the number of cases that we're seeing here in Nebraska medicine and at all the hospitals across the state. We ask people to wear masks whenever they can, and we ask people to socially distance when they can, follow all the other guidelines that are set out by Dr. Fauci and the wonderful people who have spent so much time doing research on these topics.
Okay, Dr. Miller, you are one of 3 authors. Tell us about the other 2.
Yeah, so Dr. Hirschberger is a pulmonary critical care attending here at Nebraska Medicine. He's board certified and finished his fellowship. And then Dr. Marsden is another fellow like myself. We all 3 work together in the ICU with a team of many physicians, nurses, respiratory therapists, other providers to take care of these patients who are really critically ill and needing a lot of support.
Okay, we're going to get back to that letter a little bit later, but I want to go back in time to the early days of the pandemic, Dr. Miller, and this whole idea of flattening the curve. Talk a little bit about that.
Yeah, so flattening the curve really allows us to decrease the number of patients who come in so that the resources that we have we can use to stretch and take care of all of those patients. And I think we really did a great job in the beginning of flattening the curve.
Yeah, I was going to say it seemed to be working until it wasn't. And I wanted to ask, why do you think that is?
Yeah, so I think everyone saw the patients that were getting really sick in the beginning, and they were afraid that that was going to be them and or one of their family members. And they took it very seriously, and they took the understanding that we really have to take care of our neighbor very seriously. And that, I think that led to a unified response of people who really focused on trying to decrease and flatten that curve.
Right, and then we kind of fast forward to present day. We want to put up a graphic for our viewers. So somewhere along the line, we got lost in all of that. This shows us up to late October. I know what I see when I look at this, but Dr. Miller, what do you see when you look at this?
Yeah, so this is very interesting data that you pull up, and it shows how there are times where the cases don't increase significantly, like over the summer, and then there are times like when we have decreased our social distancing and not using masks, and as well as whenever it's cold outside, that we notice that the cases become more steep. And so we start piling on cases quicker and quicker, and that's the thing that we're really concerned about, is that's where we're not flattening the curve.
Yeah, and you know, we're finding, as we look at this graphic, that no state is immune. Nebraska, a smaller, more rural state, now up in graphics like this. I mean, honestly, what do you make of that?
So I think it was slow to come into Nebraska, which was actually very great for us. There was not a lot of people who were traveling to Nebraska in the beginning of the pandemic. It was hitting the areas that had a lot higher travel a lot quicker. and the population density in Nebraska was not as high as a lot of the other places as well. So as the population density goes up, the risk of transmission goes up. For instance, if you're within 6 feet of another person, or even if you're within 10 or 15 feet, that as that number goes up and the density goes up of the population, we start to see the spread a little bit more. So it was really delayed in Nebraska in the beginning, and that was to our advantage. It really helped us as a medical center get used to taking care of these patients and learn what we need to learn as doctors to be able to give them a fighting chance. The problem is now, as the numbers go up, we don't have enough of the resources like beds or nurses, respiratory therapists, other providers to really give these patients a fighting chance.
Talk about the seriousness of that, Dr. Miller. I mean, I think, you have folks who are watching from home, obviously concerned, but not necessarily in that boat, right? And they're hearing from folks like you who are saying, we're at that point now. Drive that home a little bit for us from your perspective.
Yeah, so the seriousness from my perspective is, as a patient is out in a small critical access hospital or a small town, they always assume that they can be transported via air or ambulance to Nebraska Medicine or one of the other major medical centers in the state to get more care. And now what we've started to see, and unfortunately it even happened today, is a smaller hospital will call and say, hey, we just put a patient on or we just intubated a patient, we're doing bag valve mask, and we don't have a ventilator to put the patient on. We'd like to transfer him to Nebraska Medicine immediately. And we say, we don't have a bed for you right now. It might be a day before we get a bed. And that becomes a critical issue for that hospital who can't take care of a patient who's needing a ventilator. Even if they don't have a ventilator, or even if they do have a ventilator, they might not have the staff who feels comfortable with taking care of that ventilator and taking care of that patient who's critically ill.
Which goes right back to the patient, right? So what does he or she do then in that situation?
Yeah, so I mean, you have to trust the system's going to take care of you, and unfortunately, the system might not be here for you, and that's the concerning part. So I can't give recommendations to individual patients except to stay away from other people who are sick. Avoid, unfortunately, like I'm doing, avoiding your family during the holidays, and really care for those people that your loved ones in your life by staying away from them to try to keep them safe.
Yeah, I think also concerning in all of this is when we have leadership on the federal, state, and even local level who seem to dismiss the recommendations that our healthcare providers like yourself are making. I want to put up a photograph here to kind of drive this home. We've got Governor Ricketts at DJ's dugout, right? No masks are being worn in this photograph. Those folks are easily less than 6 feet from each other, and there's a good cluster of them. And there are photographs like this all over the place. And so I guess my question to you is, what is your advice, not just to the governor, but to everybody who's wanting to live their life somewhat as normally as possible, right? But maybe this just isn't the time to be thinking that way. I don't know. Help me out here.
Yeah, we're all having a little bit of pandemic fatigue, and we'd all like to spend time with the people around us and even go out and see people that we haven't seen in a while. Our letter wasn't written to the governor. It wasn't intended to be political at all. It was meant to be a sincere, heartfelt message from the providers here in Nebraska Medicine and now across the state to say, hey, we really care about you as patients, as fellow Nebraskans, as fellow people from the Midwest, and we really want to make sure that we're doing our best to give you the best fighting chance to make it through this pandemic as possible. And we're months, maybe a year away from getting everyone vaccinated. Could be it could be longer than months to get everyone vaccinated, but we really need to get those high-risk people vaccinated, and that's what we're trying to get through. To really flatten the curve until we can vaccinate people with a high-quality vaccine, which is what we're seeing out of a couple of the drug manufacturers who've come out with good vaccines.
You mentioned heartfelt, and I think heartbreak, right? So the more that we see photographs like the one we just looked at, the more we're going to see photographs like this next one we want to put up for our viewers. Our older adults are living virtually in isolation, many of whom are able to communicate only through glass. I ask you, Dr. Miller, what are we supposed to make of this?
Yeah, so it's extremely difficult to see, and it's difficult to see loved ones who can't touch each other and tell each other that they love them in that way. I think the more concerning thing is I've seen that same picture in real life, and not at a nursing home or a different facility, but in the ICU, where a patient's family was able to come and see them during their last minutes and hours of their life, but they were standing outside of their COVID ICU room, knowing that if they went in the room that they put themselves at risk of dying. And so seeing that from that perspective, I think the families of every patient that I've had would much rather have touched their family or touched the glass through their home or through their nursing home than through a hospital window.
Yeah. Well, and you see this from such a different perspective than we do, you know, and you've been watching it like the rest of us since March. At what point did you know, maybe you and your colleagues in the situation, that you needed to step in, that something needed to be done? And then the follow-up is, why a letter?
Yeah. So as we started to see our resources run thin, then we started to say, wow, this is going to be a big deal. And we really, as doctors, as nurses, as respiratory therapists, as other providers, we really don't want to be put in a situation where we have to make a decision on who is going to get specific resources and who is not. And fortunately for Nebraska Medicine, we have an ethics team that will help us make those decisions. And it's sad that we have to even think that we would get to the point where those decisions would need to be made.
You talk about an ethics team. Give us a better idea of what that really entails, Dr. Miller.
Yeah, so it's a detailed process where we look at different statistics on mortality for patients, and it will give a patient a calculation on their chances of survival based on a number of other factors in their current health status. And it will kind of help us triage which patients get different care.
I can't even imagine that. And you said you pulled that group together. They are active now. They come together how often? I mean, what is their status at this point?
Yeah, so I'm not a part of that ethics team, but I know that they're here. They've practiced and tried all of this technology to try to help us get through this, and hopefully they're not actually needed to be able to do that. And that's what we're trying to do, is really not have to utilize a group like that to be able to tell us which patients get care and which patients don't, because that will alter everything. And unfortunately, I spent 3 months in Africa seeing that kind of thing, where you have patients lined up all day who need to come get care in the hospital or care in a clinic setting, and you don't have enough providers to take care of them. So they'll show up the next day and the next day and the next day after that. And that's not what we need to see in the United States. I think that will be a very disturbing thing for people to see.
Yeah, I think, you know, folks may be watching. We've always been able to quote unquote pull it off, right, in the healthcare system. And I think to hear a conversation like this, there still may be, you know, those folks out there thinking they'll pull it off. These folks are great. They've been able to do it up to now. I'm sure that if I were put in that situation, everything would be okay. What would you tell them?
Yeah, even if we do pull it off, the system will be forever changed, and the people who are working here and the families who have to experience the loss of a loved one will be forever changed. And I think that that's one of the things that we really have to focus on, is that we should really all, as Nebraskans, be doing our best to make sure that this doesn't actually occur, where we flatten the curve enough that we can make it to a vaccine, which isn't that far away.
Yeah, Dr. Miller, this might be a good point in the interview to ask you, what has the medical profession learned along the way? I mean, with everything that's happened, top of mind, what are you thinking right now?
Yeah, so there's new studies coming out daily, and there's a lot of different conflicting studies. I think what we've learned is that there's a lot of misinformation out there, and to try to combat that is very difficult. You know, coming up with a rule like 6 feet, you need to stay away from 6 feet, or stay away from people by 6 feet, is a great rule of thumb, I guess I should say. So staying 6 feet away from people is the best that we knew at the beginning of this pandemic. And, there have been some other things to suggest that maybe we need to stay farther away from people. And then you look at studies out of Kansas and a couple of the other states at how good masks actually are. And we know that they are beneficial and they will save lives if we utilize them.
This might not be a bad time to just recap, and I know it's out there all the time, but while we're talking about it, the signs and symptoms, just to remind folks of what could be happening right now, how they might be feeling, and the steps that they need to take to make sure that they're getting the help that they're needing.
Yeah, so I'll direct people to the CDC's website on looking for signs and symptoms. I think and there's other places like Nebraska Medicine's website that have that information. Unfortunately for myself, I actually had COVID, and so I'm very acutely aware of the signs and symptoms, having a cough, having a headache, having fatigue, malaise all over, and malaise means just pain and tiredness all over in your body. And I can tell you that it's pretty serious. Having pain in all of your joints and your muscles is not something you want to experience. Fevers, of course, fevers up to 102, 103 are pretty miserable for a lot of people. There's a number of other less common symptoms that we see, but those are some of the major ones.
Yeah, and I think you bring up a really good point here, Doctor, that again, no one is immune. Even you, who know all the the things that need to be known, can get this. And it brings up, at least from where I'm sitting, we don't necessarily stop and think about what happens. I mean, we're working. We know what happens if somebody at work, they have to go in quarantine. But you guys, that's a whole different ball game. You start losing staff there in the medical profession, and then what do we have? So talk a little bit about that too.
So we currently have 2 critical care fellows who are at home because they've tested positive for COVID. And that really has us moving schedules around, trying to cover all of those shifts. Nurses are the same way. Respiratory therapists are the same way. Top to bottom, we're really trying to keep our own staff from getting COVID. And Nebraska Medicine has done a great job of that. After we put in the mask mandate for all of our employees to wear a mask, we saw the transmission decrease significantly. We use N95 masks, or in my case, with an N95 won't fit, not because I have my beard, which I've grown back afterwards, but my face didn't fit the N95 sizes that we had after I shaved. Then I wear a powered air purifying respirator, which blows clean air across my face. And so Nebraska Medicine has really stepped up to give us all of the personal protective equipment that we need, and at a large cost to the system, but really trying to provide the stuff that we need. And hopefully that continues to be the case. Not that Nebraska Medicine won't provide it, but there will continue to be a supply.
Yeah. We hear the term COVID fatigue, and I can't imagine any other group of people, other than those on the front lines like you guys are. Talk a little bit. How are your staffs doing, really, when it comes to this pandemic?
Yeah, so I think the thing that we don't understand is that a lot of times doctors and nurses are working many hours even before the pandemic, and so for after the pandemic and during the pandemic, we're really stretched even more thin. And so seeing doctors who've worked 20 some days in a row is just mind-boggling. And I think that people couldn't imagine working that many days in a row, but I've certainly seen partners who've done that. And one of the authors in this paper, I saw him at the end of his long stretch and looked pretty tired.
Yeah, so I can see why you'd have more than 3,000 signatures on this letter we've been talking about. The question becomes, how did you pull that off, Dr. Miller? Did you circulate the letter? I mean, how does that look for our viewers at home in terms of garnering that much support?
So we brought it up in a meeting, and it was a meeting of about 10 or 15 of us, and we said, we really need to do something. And so we came up with the idea of the letter, and the 15 or so people who were in the room were like, yeah, I'd sign something like that. And next thing you know, we had written a letter and we had sent it out to people, and it really was a grassroots effort. Nebraska Medicine was happy to let us email it out to different people. And next thing you know, the letter had over 1,000 signatures, over 2,000 signatures, and over 3,000 signatures, to the point that we couldn't even keep the website updated with all the signatures.
Yeah, I would imagine that that gave the personnel kind of a second wind, right? To have this letter presented and to feel like they were a part of a solution in a way outside of what they've been doing with the day-to-day, working with the patients, that this was a way for them to really advocate for what you wanted to accomplish, correct?
Yeah, it's pretty touching to see my coworkers stop me in the hall and say, "Hey, I signed that letter, and I think it's very important for people to understand how we feel as healthcare workers and what we want them to do." To have them stop me in the hall and say, "Hey, my family member actually has COVID," and for one of my partners, my family member's in the hospital and has COVID, and it's important for him to be able to express that we need to try to do what we can to slow the spread and flatten the curve.
Yeah, so amidst all of the challenges with this, it to me sounds like it would be building morale and pulling that fatigued staff together and strengthening one another.
Yeah, I've never seen a group of people who've been pulled together more than the providers I work with, the nurses I work with. We have brand new nurses, brand new respiratory therapists who are stepping up and doing an amazing job, having to learn on the job a lot quicker than they did before. And really, people have really come together and are very supportive. To have a team that goes around and prones patients, because we know that people on a ventilator sometimes do better when they're laying on their stomach. Their lungs do better. To go around and do that safely and effectively and coming together as a team is just very impressive to see.
I was going to ask how this is changing the interest in your profession, if more folks are going to be stepping up as a result, and how that might look in the near and maybe even distant future. What are your thoughts there?
So I think it's changed the landscape of medicine, unfortunately, for the better and for the worse. We've seen nurses who have gone to other jobs, and we've seen providers who might feel like that they want to switch to a different career path based on what they've done. People switching to other jobs in outpatient world and switching to dialysis jobs or things that are less stressful. And that's important to see that happening and know that we really need to continue to take good care of our staff.
Yeah. Talking today, COVID-19, a letter to Nebraskans. So what I want to do now is ask, what's next for you guys with this? What type of follow-up will we see, Dr. Miller, when it comes to this particular letter?
So I think Nebraska Medicine has done a great job following up with our PR that we're putting out there. There's some great videos that show live action of what's happening in the ICU. And I think that it's important for people to understand that and actually see what's going on, because if you hear about something scary, then it's not quite the same as if you see it on TV, and it's definitely not the same as if you see it in person or if you're living it. And I think that there are those stages, and unfortunately, people just hear about it, and to hear about it alone is not really doing it justice. If you're able to see it, and if you're able to see it in person, then your life will be forever changed.
Okay, so let's recap. More than 3,000 healthcare workers are asking Nebraskans across the state specifically what in this letter?
We're asking you to follow health recommendations that have been set out, including wearing a mask, staying away from other people, and really doing what you can for your neighbor. I think Nebraskans, and just like Americans, we're always there to step up for our neighbor. If we're a farmer and there's another farmer who's sick and can't get his crops in, then we're the kind of people who will go out and help them do that. We're the people who take care of our loved ones and our neighbors when they have family deaths by bringing them food or giving them a call and making sure they're okay. We're the people who really support each other. And I'm asking that Nebraskans really do that. Step up And sometimes stepping up means staying away from people that you love and telling them, you know what, we'll see you at another holiday. And that's the most important thing.
Okay, we have 1 minute remaining. Dr. Miller, I've asked you a lot of questions today. What haven't I asked that would be important for our viewers to know?
So I think how you support the healthcare providers that are around would be an important thing that a lot of people ask me. And we're not asking for any gifts or anything like that. We love it when people send letters and schools send letters saying thank you. I think that brings a joy to all of our hearts to read the thank you notes from 5th graders and 3rd graders. I think that's important to keep everybody's morale strong. And, we're really doing a good job trying to take care of everyone, but just to be patient with us and try to do what you can to be a part of this.
Okay. Dr. Miller talking about COVID-19, a letter to Nebraskans. I want to thank you so much for sharing your time, expertise, and your stories today. And I also want to let our viewers know, if you want more information about this program, please go to Nebraska Medicine. That's nebraskamed.com, 402-552-2000. Again, a special thanks to Dr. Miller, of course, to our students who are working so hard behind the scenes, and all of you for watching. As we close, a look at scenes from the Omaha riverfront as seen through the lens of Shane Thomas, a junior at UNO. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/Consider This. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
Coming up in 5, 4, 3, 2, 1. Faded press to a full.
Welcome to University of Nebraska, Omaha, home of the Mavericks. At University of Nebraska, Omaha, we take pride in our state-of-the-art wellness center that includes an indoor track, training facilities, and athletic program. If you're looking for a place to unwind, the UNO bookstore and lounging areas are available to all students. We even have our own TV station and newscast. Whatever it may be, we have you covered at UNO.